And all the high-yielding topics as well as most expected questions will be covered. And this is beneficial for everybody for all the university exams. And let's go through some core features of Auricle for those who are new to Auricle. So here we are doing live classes as well as we offer you recorded classes, which you can access anytime, anywhere. We also offer you CBME-based question answer notes. And there are MCQs also in it, which are from the beginner level to expert level. And you can use the code Dr. Divya 20 for the discount on subscription. So in the subscription plans, we have three: the basic, standard, and the mentorship. So the mentorship program is a long-term 12 months program, which we offer you at a special rate of 50,000. So here we give you pre-recorded classes, live classes, as well as live doubt clarification. And in addition, these are the same features which we see it in the basic and standard. So in addition to that, we also offer you one-to-one personalized guidance as well as notes here. So you can use the code Dr. Divya 20 for the discount on subscription. So you can book a slot for personalized counseling session on Auricle. So we'll begin with today's class. So objectives of today's class are: we are studying about the pharyngeal apparatus, the components of the pharyngeal apparatus, the ectodermal derivatives, the endodermal derivatives, and the mesodermal derivatives of this pharyngeal apparatus. So here, the questions usually asked will be to describe the pharyngeal apparatus and its components, the embryological basis for the formation of bronchial cyst and the fistula, and to describe the derivatives of endoderm pouches and derivatives of the mesodermal arches. So before we go in for the thing, we'll just understand a little bit of basics. So the intraembryonic mesoderm we learned in the last class here. It's a quick revision of the previous. So because it has a connectivity there, so we know what is what. So here we have the three divisions of the mesoderm, that is the paraxial, intermediate, and the lateral plate mesoderm. So after this, in the lateral plate mesoderm, so paraxial mesoderm, we know that they form the somites. The intermediate mesoderm is responsible for the urogenital system. Whereas in the lateral plate mesoderm, here what happens? A coelom develops and it divides this lateral plate mesoderm into a somatopleuric mesoderm, which is in relation to the ectoderm here. And in relation to the endoderm here, we have this planktopleuric mesoderm. And this will communicate with the extraembryonic coelom. Okay, so this is the intraembryonic, and that will communicate outside with the extraembryonic coelom. So after the folding, now this is the yolk sac. So here in this picture, this will be the yolk sac and this will be the amniotic cavity above. Okay, now with the folding, okay, head fold and tail fold and the lateral folds, the things change here. So we see here, this is the amniotic cavity, this is the yolk sac. Okay, so the folding occurs. So when the folding occurs, what happens here now? This is the ectoderm and this. So the floor of the amniotic cavity is formed by the ectoderm. Okay, floor is formed by the ectoderm, whereas the roof of the yolk sac is formed by the endoderm. Now the folding occurs. So in between will be the mesoderm. Okay, so here is the mesoderm. So there is endoderm, mesoderm, this white thing is mesoderm, and this will be the ectoderm. So here, now we call this as the primary yolk sac. This will be the secondary yolk sac, and this will be the tertiary yolk sac. So here, the yolk sac is invaginated inside, and this forms the primitive gut. Okay, so now here if you see, this overlying will be the endoderm. This white thing here will be the mesoderm and this will be the endoderm. Ectoderm. Okay, so that is how the folding occurs. Okay, so with the folding, what happens? These things, the septum transversum, it comes to lie downwards. Okay, so caudally it comes. Whereas this one, it goes cranially, that is the pericardial cavity, and the heart tube will come cranially. And if you see, this will be the endoderm. So here we have the primitive streak and the notochord formation. Above will be the formation of the neural tube and the neural plate and the neural tube. This is the amniotic cavity. Okay, so this is the final thing. So this is the region here, okay, where the junction, this is the gut. So this portion will be the foregut, this is the midgut, this is the hindgut. So the foregut, where it comes in contact here, Okay, so this is the ectoderm, this is the endoderm. Okay, so here will be the procaudal plate, the junction. Okay, initially in the embryonic disc, we know that there is a formation of the procaudal plate. So that is this point where they are in contact. Okay, so here will form the buccopharyngeal membrane, which later on forms the stomodium, that is the primitive mouth, and later on forms the oral cavity. Okay, so now in this region now, okay, so what happens in the foregut region as the embryo is developing further? Okay, there will be this laryngeal diverticulum, okay, from which the entire respiratory system is developed. Whereas below that will be the esophagus and stomach developing. Now, above that will be the primitive pharynx, that is from the foregut. Okay, so this is the, this we call it as the, so this is the laryngeal diverticulum. So this we call it as the pre-laryngeal part. This is the post-laryngeal. Now, for us, the concern is this one, okay, the pre-laryngeal part. So here in that region, okay, pre-laryngeal part, here what happens? Now this is where this was the notochord which was formed here. And in relation to that, this was the somites derived from the paraxial, right? So now below that is this mesoderm and the endoderm. This layer is all endoderm. Okay, so here there will be thickening. This mesoderm, it forms cylindrical bars, okay, around that primitive pharynx. So that is known as the pharyngeal arches. So you can see, so initially there will be formation of 6 arches, out of which 5th will disappear, okay. So horseshoe-shaped mesodermal bars will form, which is lined on the outside by the ectoderm and on the inside by the endoderm. So that will be the entire pharyngeal arch. So we have altogether 5 arches. 6 forms, 5th one disappears, so altogether 5. Okay, so this is the region where it forms. Okay, this is the region. So this is the prelaryngeal part. Okay, so 1, 2, 3, 4, and 5 pharyngeal arches are formed. So when we take a section, this is how it looks, and we will see what happens. So you can see outside. So this outside part is the ectoderm part, whereas the inner lining is the endoderm part. And this is the floor of the pharyngeal arch, the primitive pharynx. Okay, this is the primitive pharynx. So if you see these arches, they are only formed in the anterior, it's horseshoe shape, posterior. Okay, posteriorly, that will be the floor from which the tongue and all will develop. Tongue will develop. This is the development of tongue is forming there. So for us, we will see only this part now. So this is the endoderm. This is the ectoderm outside, and in the center is the mesoderm. And these are the structures present. We will see that. What are those structures? So definition, pharyngeal arches. So 6 pairs of cylindrical mesodermal bars, okay, covered by the ectoderm and lined by the inner ectoderm on the outside and internally by the endoderm are seen. These are the 6 pairs of cylindrical mesodermal bars. So the 5th arch is rudimentary. So we see 1st, 2nd, 3rd, 4th, and 6th arch. So this branchial apparatus or the pharyngeal app both means the same. Okay. So the components of it are, one is this pharyngeal arches, and on the outside we call them as the ectodermal or pharyngeal or branchial clefts. And endodermal on the inside, okay, that will be the pouches. Okay, in relation to this, opposite to the ectoderm here, correspondingly that side will be the pouch, endodermal pouches. And where this ectodermal cleft and the endodermal pouch will come in contact, that thin membrane will be the pharyngeal membrane. So why is this essential? Why should this apparatus be formed? Because it is very essential for the development of the face, neck, definitive mouth, pharynx, and the larynx. So all these structures are derived. All the structures basically around the face as well as in the neck region, they're all developed from this branchial apparatus. So that is why the development of it is very important. So schematic now, initially it is like this. Okay, so this is the primitive pharynx. Now this is the mesoderm here, and outside is this ectoderm. This red thing is the endoderm. Okay, so this is the prelaryngeal part. Now what happened here? The cylindrical mesodermal bars are formed. Okay, so 5th one forms, it disappears. So we have only 5 here now. 1, 2, 3, 4, and 6. So the components, these are the arches, okay, mesodermal arches. Then outside, 1, 2, 3, 4 are the pharyngeal clefts, and this side will be on the inside will be the pouches, 4 pouches. And this thing where it approximates will be the membrane, okay, pharyngeal membrane part. Now, first we will see what happens on the outside. Now, if you just observe a body, okay, from the head region, that is the face region, when we come down here, the only opening we see is our external ear. Rest is all smooth, right? So now, that is why on the cleft, the first thing what will develop is only the external ear, okay? So the first cleft, it forms the primordium of external auditory meatus. Here, I'm not talking about the pinna of the ear. Pinna of the ear, later it is developed from the ectoderm. But the cleft, okay, so that depression here, that forms the external auditory meatus, okay. So external auditory meatus, or the external ear part, no, where we have that passage, that is formed by this, okay. Right. So here, and now what happens to the remaining clefts? Okay, the second, third, fourth clefts. Now what will happen to that? Now here we do not have anything, right? No other opening. So it has to close. So what happens is this portion, no, that will overgrow, okay? And this clefts will all get obliterated. So as they are growing, and this will grow downwards, and it will fuse with this epicardial ridge here. This is the epicardial ridge. So it will be fusing here. So when it is fusing, it will enclose a space, and that is known as the branchial sinus. Okay. It is called as the branchial sinus. Okay. So sometime, and usually that gets filled, it gets obliterated completely. But if it remains, okay, patent, that space remains patent, it results in what we call it as branchial cyst or cervical cyst. Sometimes, so you can see it in varying regions, okay, along the sternocleidomastoid muscle, you can see it. So sometimes this cyst, it will communicate on the outside where it will form a fistula. So this is the branchial cyst, and sometimes if it communicates outside, it forms a fistula. So usually, since it's a developmental and basically it was the space which was not obliterated, it is not painful, okay, and it is absent at birth initially, but later on, as the muscles grow and the age advances, then it appears, okay. So we have two kinds there, a squamous cell lined because of the obliteration of the cervical sinus, and one columnar cell cyst due to failure of regression of the endodermal pouches. Okay, so it can be two types. So branchial fistula now, when it communicates on the outside, okay, it may communicate on the outside or it may communicate on the inside. If it communicates on the outside, it is external fistula. If it communicates on the inside, it will be internal fistula. So this is the skin, it is coming out, okay. So that is called as the branchial fistula. So an external fistula is due to incomplete closure of the cervical sinus. Internal fistula, what happens? The endodermal pouches, they fail to close. So complete fistula. Okay, so due to approximation of the second pharyngeal pouch and the second branchial cleft. Okay, so both will approximate, and that membrane which is present between that will rupture. So because of that, what happens? There is a common passage. So it's opening on in the inside also, on the outside also. This is where it is. Okay, so this is the first cleft. So that formed the external ear, right? This is the endodermal pouch. So this side will be the external auditory meatus here. Okay, this is what we are seeing is of the endodermal pouch. So, so this has opened on the inside also here because of the what is that? Communication between the endodermal pouch and the cleft there. Okay. Now coming to the endodermal pouches. So from the ectodermal cleft, only one structure is derived, okay? That is the external auditory meatus. Rest all obliterate. That you need to keep in mind. So ectodermal cleft, only the first ectodermal cleft forms the external auditory meatus. That's all. Now coming to the pouches, we have how many pouches now? 4 pouches, okay? So first, second, third, and fourth pouch we have. So from each thing. Okay, now correspondingly, we will try to see the structures on the inside. Okay, so already like in your classes, when you have done your head and neck dissection and the sections, you would have seen what is there from the nasopharynx onwards on the inside. So those structures correspond here. Okay, so now this is the pharynx. Okay, so in relation to the extra, that is the cleft, first cleft, we have the first pouch here. So the first pouch, what happens is the proximal portion is narrowed, whereas the distal portion here becomes the dorsal part of it. Okay, so the ventral part of it is narrow, the dorsal part of it will dilate. Okay, it will expand, it will form a cavity which is called as the primitive tympanic cavity. So primitive tympanic cavity is nothing but the middle ear cavity, and this is the auditory tube. That is why you see that auditory tube is opening into the, where this is the pouch. So this is the opening, this is the pharynx. That is why we see the auditory tube opening into the nasopharynx, right? So the middle ear will be communicating with the nasopharynx. That is why in children, especially because the auditory tube is more straight there, what happens, usually the infants, when they are feeding, we usually ask the mothers, just to keep them a little head elevated and then to burp them and all those things. If they are fed lying down and all, the milk can get into this. Okay, and that is why the otitis media, infection of the middle ear cavity and then discharge from the ear, is all very common, okay, in children. And also when we have upper respiratory tract infections, our ear also pains, ear aches, isn't it? So that is because of the auditory tube opening into the nasopharynx. Okay, so this is the middle ear cavity, and where this endoderm and the ectoderm are meeting, that is the first ear pharyngeal membrane here, that will form the, what is that? Tympanic membrane. Okay, tympanic membrane. So tympanic membrane, embryologically we say it is tridermal in origin, means it is formed by the ectoderm, then in the center there is mesoderm, and this side there is the endoderm. Okay, so that is the thing. Then as we come down from there, we come to the oropharynx. What do we see here? We see the tonsil. So from the second pharyngeal cleft, we have the, second pharyngeal pouch, we have the formation of the palatine tonsil. Okay, so palatine tonsil. So initially they are a clump of cells. Later what happens? Them cells, they disappear, okay, and they form that tonsillar crypts, which are later on lined by the oral mucosa. Okay, that is why we see the stratified squamous epithelium lining the tonsil, and we see that crypts. So the central cells will disappear here and they form the crypts, tonsillar crypts. So from the second pouch, endodermal pouch, we have the palatine tonsil. And as we come to the third pouch here, two structures are derived. Okay, so from the ventral part, we have the thymus, and from the dorsal part, we have the the parathyroid 3. Okay, parathyroid 3, or otherwise called as 3. It is called because it is derived from the third endodermal pouch. Inferior it is called because later on it occupies the inferior position. So why does it occupy the inferior position? So here if you see, this thymus normally, the normal position of thymus is where? Now it is formed up here, but it has to reach behind the sternum. Okay, it has to reach behind the sternum. So it passes downwards to, so it has to go to its normal position. So when it is migrating towards its normal position, what will happen? It will pull along with it the parathyroid 3 also. It will say, you also developed along with me, come along with me, it will call it. So it will also go down. So when it goes down, here the thyroid gland will be there. So thymus will reach its normal position, and this will get incorporated within the lateral lobe of the thyroid gland. Okay, so we see the parathyroid 3 inferiorly, whereas this one parathyroid 4 here, it is in relation to the fourth. Okay, the fourth pouch, we have the parathyroid 4, which is otherwise called a superior parathyroid. So it gets there only, since it is in that position here only, it gets incorporated into the upper part. So that is why it is superior. And then with the fusion of that fifth and sixth portion, in that relation, we have this caudal pharyngeal complex or the ultimobranchial body. Okay, so that will contribute to the formation of thymus for the thyroid, as well as, the parafollicular cells of the thyroid gland. Okay, so that is the pharyngeal pouch. So first pouch, the tubotympanic recess. Okay, so it forms the tubotympanic recess. So the narrowed part forms the auditory tube, and the dilated part, it forms the middle ear cavity. Second pouch forms the tonsil, palatine tonsil. Third pouch forms thymus as well as the parathyroid 3 and or parathyroid 3 or inferior parathyroid. And from the fourth pouch, we have the parathyroid 4 or superior parathyroid. And in relation to the sixth, we have the ultimobranchial body or the chordopharyngeal complex. So you can see here how it comes down, and this gets incorporated here. Okay. And from the ultimobranchial body, we have the parafollicular cells of the thyroid being developed. So in relation, now this is the floor. So in relation to the floor of this pharyngeal apparatus, okay, we have the development of the tongue. So the first arch, in relation to the first arch, we have the two lingual swellings forming and one tuberculum impar. And in relation to the second, third, and fourth arch, we have the hypobranchial eminence. Okay, so tongue is mainly formed by these three swellings in relation to first arch, and the hypobranchial eminence in relation to the second and third arch. So these three swellings fuse to form the anterior 2/3 of the tongue. Okay, whereas this will form the posterior 1/3 of the tongue. So this we will do it in the next class, just to know that this is where it forms. I've shown it here. Okay. So now this is to summarize the clefts and the pouches. Already I told you cleft only first cleft, whereas pouches, all the pouches here forming the different structures. So you can see here, okay, external ear, that is from the first cleft. This is the auditory tube and the middle ear cavity. Internal ear is derived from the hindbrain vesicle, okay. That otic vesicle, that forms the internal ear part, because it is mainly concerned with the nervous system, right? Cochlear, that is vestibular and cochlear nerve are there. Here we have the intratonsil. This is the tonsil. These are the clefts forming. And as we come down here, we had the parathyroid 3 and the thymus and the superior parathyroid here. Okay. Next, coming to the pharyngeal arches. Pharyngeal arches basically is the center portion here. Okay. So components of pharyngeal arch, when we call, it has a core of mesoderm, which is derived from the paraxial mesoderm. Okay. So paraxial mesoderm, you know where it is now, right? Okay. As well as the neural crest cells. Neural crest cells will be on either side of the neural tube, right? In relation to the paraxial mesoderm. And then we have the cartilaginous bar, which is derived from the neural crest. Then there is a pharyngeal arch artery, which is derived from the aortic sac and a nerve supplying the arch. Okay, so we have these. These are the four. So we should know, when we talk about pharyngeal arches, what are the structures derived from this mesoderm? What structures are derived from the cartilage? What structures are derived from the that is the muscular component, and then which is the artery there and which is the nerve there. Okay, so we'll go one by one. So first, coming to the arteries of the pharyngeal arches. Okay, so now this is the developing heart. Okay, so this is the uppermost portion is the aortic arch. So from there begins these aortic arches. Okay, or the aortic arch arteries, because here is where we have the pharyngeal arches developing. So initially now, if you see, this is the two heart tubes, primitive heart tubes. So primitive heart tubes will fuse to form the heart, okay? And they will be going behind like this. So above you can see they form this is the first aortic arch, and continues behind as the dorsal aorta, okay? So it will be going. So this portion here will be the pharyngeal arch. Then it continues behind as the dorsal aorta. This is the ventral aorta in the front, okay? So here, so arch is here. So through each of these, one arch artery will be going as this develops here. Okay, so we can see here. So this is the heart tube. So the first arch, then the second, third, fourth, sixth, like this, arches will go and they join the dorsal aorta behind. Okay, so this is where the pharyngeal arches are developing. Okay, so this is how it goes to each arch. So when these arches are formed, so when we finally see, it will be like this. Okay, the right side and the left side, they'll be going and be continuing with the thing. So from each of these aortic arches, different structures are derived. So we need to know that, okay? So what are the structures derived from the first, second, third, fourth, and sixth? So here, the first and second arch usually most of it will disappear. And from the third, we have the development of the carotid artery system on both right side as well as the left side. And from the fourth, we have the formation of arch of aorta on the right, whereas this side, it will form the subclavian artery, okay? And where is this? Okay, and the sixth arch will form the pulmonary trunk and the pulmonary arteries, okay? So we'll see how it is formed. So this is what first and second will disappear. So most of it will disappear for first arch, and a small portion will remain as stapedial artery, which we'll see it in the fetal life. And then in the second arch, we have the maxillary artery. Okay, maxillary artery is the terminal branch of the carotid artery. Then it will join the carotid artery, external carotid artery, right? So from the second arch, most of it will disappear except for a small portion which forms the maxillary artery. Okay. Now the third aortic arch, if you see here, it forms. Now this third aortic arch, okay, it will show a small bud, okay, which arises, and this forms the okay, this forms the external carotid artery, and this portion from the distal, so from the point where this bud is formed, from there, and as well as this upper part, the dorsal aorta, will altogether from the which one? Internal carotid artery. Okay, so this outer portion is forming internal, whereas the internal bud here, which is given, is forming the external. That is why anatomically, when we see, in the gross anatomy, external artery is more deeper inside, whereas the internal is more outside. It's a common viva question, why it is placed so. That is because of this development here, whereas the bud is from the bud, which is given by the third aortic arch, we have the external carotid artery, and from this we have the internal carotid artery forming. Then, okay, so here there will be a small communication between the dorsal aorta and the dorsal aorta here, that is between the the internal carotid and the lower part of the dorsal aorta. Later on, that is known as carotid duct or ductus artery, that did later disappear. Okay. Okay, so for this, next is the which arch? This is the fourth arch. Okay, so fourth arch, we have the formation of the arch of aorta on the left side. Okay, and this intersegmental, seventh intersegmental artery comes and joins here. This forms the subclavian artery on the left side. Whereas on the right side here, what happens is this portion will disappear. Okay, and only the proximal portion remains, and that will be forming here. You can see that will be forming the right subclavian artery. Okay, so this one, and remaining all the portions will disappear. This is the left subclavian. So if you see, this is the arch of aorta having left subclavian here. This is the common carotid, and this will be the external and internal carotid. This is the branch. And this portion will form the brachiocephalic artery. This is actually the horn of the aortic sac. Okay, that will be forming. So horn of the aortic sac means this portion. This portion will be forming the, on the right side, brachiocephalic trunk. Okay. And the sixth arch here on the right side, what happens? All will disappear. Okay, it will give a small bud. This is the lung bud. To the lung it will give. That is forms the pulmonary artery. And this portion distal to that will all disappear. Okay. But on the right side, because we have only one dorsal aorta, right? We do not have two. Here there are two forming then one abdominal aorta. So on the right side, it all disappears, whereas on the left side here, it forms the dorsal aorta, and this will be connected, okay? The which will be forming the descending aorta, and the pulmonary trunk will be connected pulmonary arteries by this ductus arteriosus, which will later obliterate, okay? So when we take the aortic arches, so actually when you're writing a pharyngeal arches, okay, you just have to write this, okay? I have explained to you how it forms, but when you write the answer, you don't have to write everything unless the question is write about aortic arches. If it is about pharyngeal arches, okay, you just have to mention first arch, which is the artery. So the first arch, it mostly disappears except for a small, okay, first aortic arch disappears except for a small part, that is the stapedial. Actually, here it is other way around. And second, it forms the maxillary. And third, the ventral part will form the common carotid. Dorsal part will form the stem of the internal carotid. Okay. And that bud will form the external carotid. Fourth arch, right side, it forms the subclavian, proximal part of subclavian artery. Left side, it will form part of the arch of aorta. Arch of aorta is formed from this one, the left horn of the aortic sac also. Okay. Fifth arch disappears on both sides. Sixth arch, the ventral part persists as the right pulmonary artery here on the right side, right pulmonary artery, and the dorsal part, everything will disappear. Left side, the ventral part forms the left pulmonary artery, and dorsal part will persist as the ductus arteriosus, which will later form the ligamentum arteriosum after birth. Okay, so now coming to the nerves of the pharyngeal arches. Now, nerves of the pharyngeal arch. So the first arch nerve, okay, it is called as the mandibular. Okay, so basically comes from the trigeminal, that is the mandibular nerve, first arch artery. Okay, the second arch artery will be the facial. Here it is it is not corresponding here. Basically, second will be the facial, third will be the glossopharyngeal, and fourth will be the superior laryngeal, and fifth will be the recurrent laryngeal. Okay. Sixth will be the recurrent laryngeal nerves. So basically, for the first two arches, there will be a post-traumatic. Trema means cleft. Okay. So before the cleft is the pre-traumatic. After the cleft is the post-traumatic. So here the post-traumatic arch nerve is the mandibular nerve, and the pre-traumatic is the chorda tympani nerve. Okay, chorda tympani is coming from the facial. Okay, that is for the first arch. So this chorda tympani nerve will persist. Facial nerve here. For the second arch, facial nerve is the main arch, post-traumatic, whereas the pre-traumatic is the tympanic branch of the glossopharyngeal. Then for the third arch, it has only the post-traumatic, and the fourth arch will have the superior laryngeal, and the sixth arch will have the recurrent laryngeal nerve. Okay, so that is about the nerve. So you just have to know which arch, which nerves. Okay. Now cartilages. So the first arch cartilage, we call it as the Meckel's cartilage. Second arch cartilage, we call it as the Richard's cartilage. Then third and fourth arch. Okay. So here, as I say, I will tell there what structures are formed there. Okay, so you can see here. Arch cartilage. Okay, so the first arch cartilage will form which one? The malleus, okay, the spine of the sphenoid and the incus. Okay, so malleus, spine of the sphenoid and the incus, as well as here, okay, spine of the sphenoid, malleus, then incus, then the sphenomandibular ligament here. You can see this is the sphenomandibular ligament. Okay, and this is the remnants of the Meckel's cartilage here. So these are the main things: malleus, incus, and the sphenomandibular ligament which are formed. Second arch, we have the stapes, the styloid process, and the stylohyoid ligament. Okay, stylohyoid ligament. They are formed from the second arch. So basically in the posterior part, it will form from this, the ossification takes place and the bony parts are formed, okay? But anteriorly here, for the first arch, we have the mandible here, okay? It contributes there. But for the second arch, nothing is, the only bone is right in front here. So that is why it forms the ligament there, okay? It forms the ligament, that is the stylohyoid ligament. And also it forms the lesser cornu and the upper part of the body of the hyoid, okay? So that is derived from the second arch. Third arch cartilage, we have the lower part of the body of the hyoid bone and the greater horns, okay? Greater cornu. And fourth and sixth arch, we have the formation of thyroid cartilage, cricoid cartilage, arytenoid, corniculate, and cuneiform. They are all the cartilages of the larynx. So they are all formed from the fourth and sixth arch, okay? So here also you can see it is one more picture. So structures derived from the first arch: incus, malleus, spine of the sphenoid, sphenomandibular ligament. And this will remain as the this thing, Meckel's cartilage remnants, and mandible contributes to the formation of the mandible. Second arch, stapes, styloid process, stylohyoid ligament. Everything SSS here, okay? Stapes, styloid process, styloid ligament, lesser cornu, and the upper part of the body of hyoid. Then third arch, greater cornu and the lower of the body of the hyoid. Then fourth and sixth, thyroid, cricoid cartilage, okay, as well as the arytenoid, corniculate, and cuneiform. Then coming to the muscles, okay, so the muscles which are formed. So first arch is all the tensor tympani, tensor velli palati, muscles of mastication, anterior belly of digastric, and mylohyoid muscle. Mainly the muscles of mastication and anterior belly you should remember, because they ask you in Viva. And the nerve supply is, that is why all these muscles are supplied by the branches of mandibular nerve. Then second arch, we have stapedius, styloid, posterior belly of digastric, platysma muscle, auricle muscles of facial leg. Important here is the muscles of facial expression, the stapedius, styloid, posterior belly of digastric, okay? And supplied by the branches of facial nerve. Third is from the third arch is stylopharyngeus muscle. The nerve of the compartment is glossopharyngeal and it supplies. Fourth arch is cricothyroid muscle, levator villi, constrictors of the pharynx. So external laryngeal branch of the superior laryngeal nerve. Okay, so that is derived from the vagus. So it supplies, okay, cricothyroid, levator villi palati, constrictors of the pharynx. They are supplied by the external laryngeal branch of superior laryngeal nerve. Sixth arch, all the intrinsic muscles of the larynx except for cricothyroid, because it is derived from fourth arch. This is again a Viva question, which muscle is not, intrinsic muscle is not derived by sixth arch, or why cricothyroid is supplied by external laryngeal branch. So you should know the answer, okay? So rest all intrinsic muscles are supplied by the recurrent laryngeal nerve. So first arch syndrome. So now if the structures are not well formed, so what happens here? It results in different syndromes, trichocolin, DiGeorge syndrome. So this is basically due to lack of migration of the neural crest cells, okay, because they are essential for the formation of all that different elements of the arch. Then Perry-Robbins syndrome, so it's autosomal recessive, so it occurs in about 1 out of 85,000 births. So here this three triad is there. It's a very classical triad of this micrognathia, that is very small, tiny chin here. You can see it's not very well developed. Then cleft palate. Glossoptosis means the tongue is very much posterior. So you can see this is the mouth, tongue is so behind, okay? Glossoptosis. And the main defect is the mandible, very small mandible. That is why the tongue becomes very posteriorly placed. Then DiGeorge syndrome, there is the microdeletion of the long arm of chromosome 22. It occurs 1 in 25,000 births. There is absence of thymus and the parathyroid glands here. Trichocolin syndrome, it is an autosomal dominant. It can occur 1 in 85,000. So malar hypoplasia, okay? So these cheekbones. Then mandibular hypoplasia is there. Then the palpebral fissures, if you see, they are downwards and slanting, and ears are deformed. So to summarize, So pharyngeal arches are the mesodermal bars. There are 6 mesodermal bars. Fifth one is rudimentary, and it will have how many arches? So there are 5 arches, first, second, third, fourth, and sixth arch. Clefts are 4, first, second, third, and fourth. And pouches are also endodermal. These are ectodermal clefts. Endodermal pouches are 4. Okay, so from the first ectodermal cleft, we had the formation of the external auditory meatus. From the first endodermal pouch, we had the formation of which one? The auditory tube and the tympanic cavity. And the membrane there, it forms the tympanic membrane. That is where the ectoderm and endoderm approximate. Then pouches here, all of them, rest of the pouches, the clefts will all obliterate. From the second pouch, we had the tonsils. From the third, we had the parathyroid 3 and thymus. And from the fourth, we had the fourth parathyroid, okay? And sixth there, in relation, we had the ultimobranchial body forming the caudal pharyngeal complex. So the arches will have the arterial element, the cartilaginous element, the muscle, and the nerve, okay? So nerve is here the mandibular nerve, post-traumatic, pre-traumatic is caudal tympani. Here it is facial nerve. And here it is for third arch is glossopharyngeal, fourth arch is superior, so this external laryngeal branch of superior laryngeal, and recurrent laryngeal is of the sixth. Okay, so this is what condition. Now here, this is for because of the ectodermal. Yes, the clefts are not obliterated. So this is called as the branchial cyst. This is the branchial fistula. So here, this is trichocolin. This is Perry-Robin syndrome. Okay, Perry-Robin, and this we have the DiGeorge syndrome. Okay, so you can identify that. So thank you for watching Auricle. So for more content, you can follow our social media handles on YouTube, Instagram, Facebook, and Telegram. And if you haven't yet, and those who are new and haven't yet downloaded the app, you can start your journey with Auricle by downloading the app on Google Play and App Store right now. Until then, next time.